Hello and welcome to Module 4, the role of diagnostic imaging. Our objectives for this module are to discuss the importance of diagnostic imaging in wound management. We're going to define the term theranostic, detail the use of fluorescence imaging, and also detail the use of near-infrared spectroscopy. Diagnostics in wound management. There are a wide range of clinical or laboratory tests used in wound diagnosis, assessment, and management. These tools vary in their degree of helpfulness. Some prove or exclude a diagnosis, while others assist in determining the appropriate interventions. Common tests for wound management are ankle brachial indices or toe brachial indices, lab workups, and x-rays. Some tests do not necessarily provide or lead to a diagnosis, but provide very specific information that indicates the need for or the suitability of a particular therapy. This type of test is known as a theranostic. The development of theranostics are of particular interest in wound management because they have the potential to ensure that treatments are targeted specifically to patients who will benefit most from them. Let's talk about some advanced diagnostic imaging. Diagnostic imaging tools are used as part of an integrated, structured approach to wound management designed to ensure appropriate patient treatment. The utility of data obtained from advanced diagnostic images can help indicate the need for a clinical intervention, can assist in indicating the form of that intervention that would be most appropriate, and then also can indicate if a treatment has been successful. First, we'll discuss fluorescence imaging. A biological marker that has utility as a predictor for wound healing is tissue bacterial levels. Wound healing becomes compromised once bacteria have invaded. High levels of bacteria in the tissue impair wound healing and contribute to sustained inflammation and stalling of wound tissue regeneration. Identifying and managing bioburden and bacterial levels are important as an aspect of wound management. Traditional wound cultures will only select for microbes that survive under conditions conducive to laboratory settings and may not represent the diverse microbiota present in a chronic wound. It can therefore be challenging to identify those wounds that have high levels of pathologic bacteria. Clinical signs and symptoms of wound infection may be lacking in patients that have immunocompromised systems. The Moleculite is a handheld, non-invasive, point-of-care fluorescence imaging device that is used to instantly visualize potentially harmful bacteria on the wound surface and the surrounding tissues not otherwise visible to the naked eye. The device emits a safe violet light that illuminates the wound and the surrounding tissues, exciting the wound tissues and bacteria, resulting in endogenous production of fluorescent signals. The various fluorescent signals produced by this device are tissue-specific. Endogenous tissue components such as collagen will fluoresce green, while bacteria that produce porphyrins will fluoresce red, and Pseudomonas that produces pyridine will fluoresce cyan, which is a white, blue, green. The Moleculite device has been extensively validated in patients with chronic wounds. Clinical trials have shown that endogenous products emitted from bacteria allow for visualization and location when bacteria is present at loads of 10 to the fourth colony forming units or higher. Keep in mind that 10 to the sixth colony forming units are typically considered infected wounds. The device has been noted to detect fluorescent bacteria byproducts on and beneath the surface of the wounds up to 1.5 millimeters in depth. Numerous poriform-producing bacteria species can colonize on chronic wounds and cause this red fluorescence. Typically, Staphylococcus aureus is the most commonly found bacterial species in these wounds. You can see the red fluorescence in the picture on the screen. Cloverdine is unique to Pseudomonas. Thus, it is the only bacteria to fluoresce a cyan. And you can see the second arrow will show you areas of that cyan fluorescence, indicating Pseudomonas is present in that tissue. Fluorescence imaging has clinical utility. I have studied this particular diagnostic image and had a publication in the Journal of Wound Care in 2020, which indicated the clinical utility for targeted debridement. It can also help in tracking the needs for effectiveness of antimicrobials and track the need and effectiveness of antibiotics as well. Next, we're going to discuss diagnostic images for tissue oxygen saturation. As we've already covered in other modules, oxygen levels in the tissue are a major contributory factor in determining the clinical pathway. Low levels of oxygen in wounded tissue will prolong tissue regeneration. Maintaining adequate levels of oxygen in wounded tissues continues to be a challenge. The oxygen gradient in wounded tissues is unequal. The supply may not meet the demand. This is especially true in patients suffering from systemic conditions such as diabetes, arterial disease, and venous disease. Although the etiology of non-healing chronic wounds is often multifactorial, hypoxia is a common component in the vast majority of cases. Near-infrared spectroscopy, or NIRS, is an emerging technology that has been successfully used to evaluate functional tissue oxygen saturation in the management of diabetic foot ulcers. Examples of commercially available NIRS devices are the Snapshot and the Mimosa. These non-contact devices are handheld, mobile, and offer repeatable, immediate images that can be used to determine site-specific, quantifiable levels of tissue oxygen. Again, functional perfusion to the tissues. These diagnostic tools utilize different optical signals based on the proportion of oxygenated hemoglobin found within the tissue capillary bed. Computerized algorithms measure oxygen saturation of tissues, thus correlating to tissue perfusion. These images obtained allow clinicians to get a better idea of the microcirculation and functional blood flow to the wound, as well as the surrounding tissue. You can see in the example photos, upon initial intake, our patient had a 58% oxygen saturation in the wounded tissue. After 1 week of topical oxygen therapy, the second photo shows that his oxygen saturation to the tissues went up to 78%. Determining the oxygen level in wounded tissue can be a valuable biomarker to track throughout the phases of wound healing. This data can assist healthcare providers in identifying the healing potential of a wound. Tissue oxygen levels can indicate the need for a vascular intervention or the utility of topical oxygen therapy. Tracking oxygen levels with near-infrared spectroscopy throughout the course of therapy can help support the use of current treatment regimens. In summary, diagnostic imaging devices can detect substances or biologic factors that will affect wound healing. These biomarkers can serve as a key indicator for the cause of wound chronicity and the effectiveness of various treatments. The use of diagnostic imaging devices should not be regarded as an alternative to thorough clinical assessment and monitoring of the patient and the wound by experienced clinicians. Thus, these devices are helpful tools used to augment the information that you've obtained from the complete patient and wound assessment. Here are some additional references. And that completes Module 4. To complete the test, please click on the red test icon at the bottom of your screen with a clipboard and pencil on it to receive your certificate of completion for this module. Thank you.